Hey guys, welcome back to our channel. Welcome back to my channel, My Crazy Big Black Family on YouTube. Happy Thursday. Vlogmas Day number 21. I'm a little late here, as you may tell or see. I just woke up. I had to take a long nap. Today was my first day at my new job. That's, by the way, Vlogmas Day number 21 is learning and starting a new job. Comment down below, and don't forget, if you're new on this video and you just watch this video, you just tuned in this channel, please don't forget to hit the subscribe button, and don't forget to get all notifications for all uploads from My Crazy Big Black Family. Welcome to my channel, guys. Happy Thursday, as I stated. So this Vlogmas Day number 21, Thursday, about to be Friday, because it's about 11:41 p.m. And I'm just catching my Vlogmas, guys, but got to stay dedicated. So here we go. So today I started my new job to go with my small business job, which is never ended and never goes away because it's my baby. I own it. We own it. But I started a job outside the house today, and I learned a lot of stuff today. Because I'm going to be working in a healthcare business, we had to do a training about dementia today. A lot of people in the world have been affected by dementia. A lot of people in the world have been affected by a family member, or a loved one, or a grandparent, or somebody who has Alzheimer's or dementia or something like that. And what we did was we learned about it thoroughly. We learned about how to interact with people with dementia. We learned about how to care for people with dementia. We learned about how to be patient with people with dementia. We learned about how, I guess before, in the beginning, you could, if a person's, probably in the first stages of dementia or just going through it. And this is certificate, because I was certified today too, guys. By the way, not only did I take a training, but I also got certified in dementia training. So I'm certified where I don't have to ever take dementia training again, because I have been certified in such class. So she also told us that, about, you have to be patient with people with dementia. You have to never ever, because I guess in the beginning, when they're still, when you're able to still, stage 1, maybe stage 2, because I didn't even realize there were 4 stages or whatever to that too, but I guess that's how the medical field works. You should be able, yep, she's here. You should be able to, correct, a little what they may be off about. So if they're off a little bit in telling their story, it's okay to tweak it a little bit, and just not tweak it, but to correct them, but not to yell at them, not to be harsh with them, not to act like you don't understand them, because that makes them confused. That makes them not understand. That leaves them, in a place where they got to gather everything. I learned today that when you have dementia, you got to kind of do things in catch up with things. The brain has to catch up with whatever's going on the outside. People talking to them, people giving them orders, whatever. So the reason why I'm doing this Vlogmas video today, Vlogmas Day number 21, guys, is to bring awareness to small, not small, excuse me, I'm getting off track. To bring awareness to people who are living with dementia, people who have to care for dementia, or to bring awareness and let people know that we have to be patient with our loved ones. We have to be patient with our parents or those who may be suffering from dementia. There's stages to this thing. There's a progression with dementia, I'm pretty sure, with medication and things like that, it probably will progress a little bit, a little bit slower. But we also learned today, for whatever reason, when a younger person gets dementia before 65 years old, their progression goes quicker than a person who gets dementia when they're in their 60s. And why is that? I don't know. But if you get dementia before your 60s, because I guess it's like a aging, also an aging disease, but with the brain as well. It affects the brain, and the brain's like ability to make decisions, the brain's ability to send the waves to whatever part of the body to do this, to make the body get up and do that. Well, in having dementia, slowly that deteriorates, so you won't be able to do that. In the beginning, things still be able to do it, but then as your illness progresses, or your disease, should I say, you will lose more of the functioning aspect that the brain allows one to function with, which is most of everything, because there's a part in our brain that tells us, the receptors that tell us to do this. It tells us to touch this. It tells us to go like this when my nose feels like it's running. The brain does that. Well, when you have dementia, you find out that stuff starts to, they showed us the brain without dementia, and then they showed us the brain with dementia. And the brain with dementia is like, it gets smaller. It's not puffy anymore, because I guess all that things that's inside that's needed to progress or do what you have to do, because of throughout dementia, you lose that. You lose the muscle, and you lose all that, not muscle, but all those, the fluffy part of the brain, and it becomes like smaller, because again, all those important things that you need to know with dementia, it slowly takes that away. So, and I also, like I said, started a new job today, guys. The word of the day is just compassion in dementia. Take things slow. Understanding is good, I learned, because I guess you just don't know. You may think, and I learned this today too. They said that, you may think, like, as their illness gets on, like, say if they're saying something, and we had to watch like videos about this, and again, we got certified in it. I have an actual certification in dementia, which states I will never have to take a dementia training, no matter. I could work wherever with people with dementia, and I don't have to take a training, because I already sat through it, and I already been trained and certified. What we learn is that, we tend to, like, we'll when they're trying to explain themselves, or we're trying to explain to them what we got to do. We watched the video, and in the video, like, it showed you two scenarios. One scenario where the lady was so rushed, telling the lady all this stuff to do this, do that, 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 and she wasn't compassionate with her. She wasn't taking her time with her. She was just throwing all this stuff, and the lady just got out the bed, and she has to, like, she's trying to gather herself together, and the lady's sitting there like, oh, you got to do this, and you got to do that, and you got to do this, and you got to come on, and the lady's standing there, and she's just like still trying to suck it in, each layer of what the lady's telling her, but she's still on layer 1, and the lady's on layer 45, and so she just, like, at the end of the scenario, she just didn't do what the lady said, and that's what it boils down to. You pile too much on them, you give them too much, or their brain has not caught up to all the different things that are being told to them, because they have to process things a lot slower, because the brain is still catching up. You're up there, but they're still trying to slowly bring it together, guys. So I say all that to say this: happy Vlogmas Day number 21. Learn about dementia. Read about it. If you can, take a class about dementia, because at some point in our lives, we may have a family member or loved one who may be affected from dementia. Apparently, it's going, as people get a certain age, it is a part of, most lives these days. And certain things can contribute to you definitely acquiring dementia. So try to, if you have a family member or loved one who does suffer from dementia, try to be compassionate. Try to be understanding. Don't try, and the worst thing they told us, don't Don't be like, no, no, that's not how it goes. You don't do that. You don't correct them. You don't yell at you literally be where they're at, is what they told us. If they think it's 1989 and Maria, their cousin, didn't pass away and she's still alive, then you sit there and you say to them, it's you play that game, because you don't want them to get like upset because they can't, like, what they're giving to you seems to be so off. So you want to keep them level, and you be like, okay, yep, okay, yep. That's what we learned today. We learned that you go with whatever they're going with, and you make them comfortable, and you just, like, you receive it, and you don't be harsh with them, and you don't yell at them, and because their brain is confused. In their brain, that's what it is. Their understanding is that it's like this. It's 1980, whatever, and Maria is still alive, and we're outside chilling, and we're hanging, and this and that. But that's not the case, because those things have changed. But in dementia, you think it still is. So you coax that. You say, okay, yep. You don't want to stop it, get them all yelling, and then be like, oh, no, that's not how it's supposed to be, this, that. You just let it go. So I say that to say all this, guys. Just have patience. Be patient. Learn about, illnesses. Learn about different diseases that we may be faced with in our lives. And starting a new job, especially when it's like a job, like a career type of job, or the type of job where you're going to be in it for a while. You want to get to know about it. You want to take as many notes. That's what I did. I took so many notes. I was just like sitting there listening to everything I could, because I didn't want to miss anything, guys. Hug your loved ones. Spend time with your loved ones, especially our older family members and our older loved ones, because there is a such thing out there that is dementia. And we think that they're, just sputtering off at the mouth, or they're saying things, but they may. Or get your family member. Make sure that they don't suffer from the early stages of dementia, or they're not suffering from the early stages of dementia, guys. I want to thank you guys all for watching this video. I hope this video was informative to you guys. I hope that if you're caring for a loved one or a family member who has fell victim to dementia or is going through dementia, that you take a training or take a class about training, so that you will know how to care for them. You will understand. You will know how to be compassionate and not to blow up at them, just to take things and understanding slowly. Because like I said, we watched several videos and scenarios about progression of dementia, the beginning, and then like towards like when you're in like stage 4 or stage 3, where then you really can't like get around, and you need help doing this, or you need help because the brain totally has lost that part of the memory that tells you to brush your teeth, that tells you to wash your face, that tells you to get up and go walk in the bathroom. Unfortunately, dementia takes that away when you get to like past to like the 4th stage or whatever. Thanks, guys. Don't forget to subscribe to my crazy big black family. I hope you guys enjoyed this video. Happy Vlogmas Day number 21, guys. Stay tuned for more videos. See you guys tomorrow. Bye.